Hi everyone, my name's Emily Wishern and I'm a PGY1 here at IU. Our intern year started off initially with a super fun barbecue that was thrown by the residents here at IU to welcome us into the program. And then we started our rotation shortly thereafter in July. Something unique about our program is that we start our first rotation with a orthopedic boot camp where we get surgical skills training and experience in the anatomy lab, getting comfortable with surgical approaches and getting to know each other. And then we do 5 months of non-orthopedic rotations, including trauma surgery, the surgical ICU, neurosurgery, plastic surgery, and musculoskeletal radiology, along with 6 months of orthopedic rotations, including 2 months of orthopedic trauma, pediatric orthopedics, sports, and oncology, and then a night float month, which is awesome because we get a lot of hands-on experience practicing fracture reductions and putting in traction pins and helping out the call resident to get more experience with orthopedics.
Hey guys, I'm Casey Valekis, one of the second year residents at IU. Second year we began taking in-house call covering Eskenazi, one of our level 1 trauma centers, Riley, which is one of our pediatric trauma centers, University Hospital, and the VA. Second year you do rotations in pediatrics, trauma, foot and ankle, a rotation at the VA, oncology, and adult reconstruction. Second year is great. You're primarily doing team rotations, which is always a lot of fun. And then as a group, the whole second year class gets to go to the OTA fracture course, which for our year was in Denver.
Hey, I'm Abhi Sitaram. I'm currently a PGY2 here in Indiana. And I am actually on the 6-year research track here. So it's kind of a new track, and I'm the first resident to go through it. But essentially, my PGY2 year looks exactly the same as Casey's, which you heard about earlier. And I'm taking a year off after PGY2 year to kind of focus on research before coming back for my PGY3 year and the rest of my training. So I'm looking forward to the year. It should be a good opportunity. I'm working on a handful of projects, both in the basic science realm as well as the clinical science world. And so kind of excited to get some experience and learn more about research as well as how to contribute to the field of orthopedics and hopefully make a meaningful impact to my work.
Hi, I'm Jeff Klott. I'm one of the orthopedic third years here at IU. Big thing with IU is we do kind of get a lot more operative experience as a third year. We do 2 different trauma rotations. One's at Methodist Hospital and one is at Eskenazi Hospital. We also do a rotation with one of the private hand groups in town, Indiana Hand and Shoulder Center, as well as one of the private spine groups in town, the Indiana Spine Center. And then we end out our year doing our sports rotation. So it's really a really good year for us as far as getting a lot of different variation and a lot of operative experience. The other big thing with our third year is we get to go on a conference. Now we're kind of switching around which ones we're going to do this year, but they always find a good one to go to. So it's a fun time and a good bonding time for all of us.
Hi everyone, my name is Joe Jacobson. I'm one of the current PGY4s here in the residency program. I'm currently on Eskenazi Trauma Service. The PGY4 year is nice. You're finally treated like a senior resident and you get to start operating very frequently this year. The rotations we do general orthopedics, we do sports, we do trauma, we do pediatrics, and we do a joints rotation. Like I said, it's a great year to really hone in on your operative skills, and you really get to build on the foundation of knowledge that you've built over the first 3 years. The nice thing about the PGY4 year is it's the year we all apply for the fellowship match. So all of us went through that as a class together, oddly reminiscent of when we interviewed for residency. A lot of traveling, a lot of staying in hotels, and getting to know a lot of programs. I'm happy to say I matched at Emory for foot and ankle, and I'm excited to finish up my last year here at IU and head off to Atlanta for my last year of training.
I'm Aaron Basler. I'm a PGY5 at IU. As a 5th year resident here, you're considered a chief resident, which gives you some administrative duties in addition to clinical duties. As a 5th year here, we do rotate in trauma, upper extremity, pediatrics, the VA Medical Center, and then an elective. For my elective, I work with a private surgeon in shoulder. It was a great experience for me. Next year, I will be going to Campbell Clinic in Tennessee for my sports medicine fellowship. I feel like this residency has prepared me well for that. I feel like I can take on any case take care of any patient.